As you get into lifting and moving, and of course this ends up being one of those chapters that we're definitely going to be doing hands-on, but we have to talk about it. You know, what all do I have that I can use to lift and move a patient? Now ultimately it comes down to making sure that you are you're first wearing the right clothes, right shoes to be able to lift and move. And then the other thing is, do I have the right equipment? So figuring out which equipment I need for whatever it is you're doing. So we've always had our long spine boards, our back boards that we can place a patient supine, move them to a stretcher. You may be going across a yard, you may be going uneven terrain, you may be going up and down embankments, that kind of stuff. So you have to figure out what's going to work. The advantage of a backboard is that I can also strap my patient in. So I've got the straps that I can put them on, and that way I can transfer them onto my stretcher that way. Of course, anytime I do that, I want to make sure with a backboard, I want to pad the voids. So I want to pad behind their neck if I don't have a C-collar on, if I'm just doing it strictly for movement. If I'm doing it because I feel like that they have injury to their neck or spine, then I want to keep them as straight as I can, and I want to pad those voids that the C-collar is not already securing. We have different types of lifts that we do, so our body mechanics is a huge piece. This is where I have to take care of me. If you're not in the right position to move a patient, stop. Everybody just stop, regroup, re-angle yourself so you know you won't hurt yourself, or get more help. Sometimes it's about getting more help too. And then you're ready to make your lift. We don't lift with our back. We have to lift with our legs. If your legs aren't real strong, this is when I have to start working out on that. We sometimes have to do a power lift. So we're taking the patient and we're lifting straight up. And when we do that, you may be going from ground all the way up. To at least to your waist. We also have our scoop stretchers that we use. They will undo at the top, basically at the head and at the feet, and that way you truly just scoop the patient up. The thing you have to watch with the scoop stretchers is that in the center there, it will potentially, depending on how much adipose tissue they have, it could pinch them. So you want to make sure that you don't pinch up any tissue there. Sometimes you may have to use a power grip, so I'm either going to grip this way or I'm going to grip this way. And this is where we practice, so you can figure out which way works for you. Sometimes we may just get a sheet and do a sheet drag. So I'll put the patient on a sheet or a tarp, and we move them that way. Sometimes you'll just put them in a chair and you'll move them that way. The patient's weight is a big thing. You figure out what your weight number is. You know, if I know that 300 pounds is about all I can handle, that's where I say time out, we need some help. Or if it's 200, time out, I need some help. You got to figure out what your number is. Lifting and carrying, 4 providers in a diamond carry. So I have one on either side and one on each end. And that way we distribute the weight around a board, a stretcher, whatever it is that you're having to move. So we do diamond carries. One-handed carry. So everybody gets around. So you do basically a 4-corner. So one on each corner, and everybody's got one-handed. That usually works better for smaller people. If they're bigger, I like the diamond better. It distributes the weight a little better. We also have stair chairs, so with our stair chairs we'll put the patients on. Most of them now have tracks, so if you're going downstairs it just glides right down, and we'll practice with those as well. It saves your back a lot. In worst case scenarios, if you had to, you could put a patient on a backboard, stand them up, turn them. Some of these staircases that are circular, that there's no way you can take them straight out, you may have to stand them. You can't go horizontal, you have to go vertical. So we'll practice with those as well. And then once you get them on the stretcher, so the stretchers are pretty easy. The problem comes in when my stretcher battery dies or I have a manual stretcher. So I have to figure out those two things. The power lift stretchers are fantastic until that battery dies. And now I've got about 130 pounds on top of how much this patient weighs that I've got to lift. So, you know, I'm going to be nice and say you have a 200-pound patient plus a 130-pound stretcher. Now I've got 230 or 330 pounds that I've got to lift. So yeah, send me some help, or send me another truck that's got a battery that works, because usually what ends up happening is your battery dies and then your spare battery is dead, and that's when you get into a world of hurt. So emergency moves, that is when you are in that potential for danger. So you're in a situation you have to drag or pull the patient to a safe place before assessment can be provided. So that's usually fires, explosions, or hazardous materials. And you have no other way to protect the patient from your hazards. So you grab them, get them out of the way of danger, and then you have to reassess there. We try to take care of C-spine as much as we can, especially if they are in an MVC. Motor vehicle crash, but you don't know for sure, you know, what's happened. So dragging methods, you have emergency clothes drags, you have blanket drags, and arm-to-arm drags. One person technique for moving an unresponsive patient from a vehicle, you can grasp the patient under their arms or lower the patient down into a supine position. So just kind of grabbing them, getting them out, and then lowering them down, and go from there. Your one-person drags and carries, you have a frontal cradle, a firefighter drag, a one-person walking assist, and a firefighter's carry, and a pack strap carry. We don't recommend one person. We do try to get at least 2 of us, sometimes 3 or 4 of us. And we don't do it, if you do have to do it, you don't do it very far. Ergonomically, you know, everything that you'll read says we shouldn't be lifting any more than 50 pounds. And that is just so that we don't hurt our backs, we don't hurt our shoulders, our knees. Those are the things that give out first. So if we're constantly lifting that, you know, even 120 to 200 pounds like that, then it's going to take a toll on our body. Now, you know, I can remember we had one of our guys, he's very fit, you know, bodybuilder type guy, and he picked up a little grandma that might have weighed 100 pounds soaking wet. I'm like, okay, that's alright. That's very different. He bench presses more than that. So there's your exercise for the day for 1 repetition. I mean, really, come on. So just use your common sense there. Your urgent move, it may be necessary to move a patient with an altered level of consciousness, inadequate ventilation, or shock, that hypoperfusion. So extreme weather condition may also make an urgent move necessary. So in some cases, your patients may be urgently moved from a location or position in which they're found. So when a patient who is sitting in a vehicle must be urgently moved, use your rapid extrication techniques. So usually with that, I want it less than 1 minute. So with my emergency move, it's got to happen now. With my urgent move, I've got about 1 minute, and I should have them out of the way. Direct ground lift, you may have them lying either on their side, or you may have them lying flat, and 3 of you get under them and just lift them straight up. That's your direct lift. Extremity lift, so I take somebody's arms and I hold them here, and I get a hold there and a hold here, and I'm behind them and I'm able to lift straight up, and then somebody gets their feet. Direct carries, kind of the same way. You get up underneath their arms and you just move them over. A lot of times if they're at home, we'll just grab their sheet, move them all over at the same time. We do sheet methods, that sheet drag. Talked about your scoop stretcher. If you have a patient who has skeletal changes, so they have kyphosis or spondylosis, you're going to have to pad those voids. So make sure you get pillows or towels, blankets, whatever, sheets, whatever you've got that you can fill in those voids where they're humped over, because that's not going to be very comfortable ride if you don't. We have flexible stretchers, portable folding stretchers, short boards, vacuum mattresses, basket stretchers. Talked about your scoop stretchers. The isolettes, most of us do not carry them. Those usually go to your critical care, specialty critical care. So like Brenner's Children's Hospital, or if Chapel Hill has their NICU team come down, they may bring their isolette. When you're decontaminating your equipment after, unfortunately, a lot of times your patients will pee or poop on your stretchers or whatever, just based on what they have going on. They can't control it. So you're just making sure that you wipe it down every time between patients, just to make sure. Patient positioning, you want to make sure they're in the best position for whatever they have going on. With your obese patients, you want to make sure that you never lay them flat, because that decreases their ability to breathe well as what's going on with their heart potentially can actually put them in cardiac arrest. So we don't want to do that. So make sure you keep them sitting up with your obese patients. Medical restraint, while not a common occurrence, there may be a time when you're called on to physically restrain a patient with those behavioral emergencies. And we'll talk a little bit more about that, but we'll talk about how to use the medical restraints and your stretchers or your equipment. Sometimes it may just as simple to, especially if they've been in a motor vehicle accident, or if they've hurt themselves or something, that you can either put them in a vest type device that straps them in, or a scoop stretcher or something that you can strap them down and secure them a little better. So, and then personnel considerations, just making sure that, am I physically strong enough to lift and move this patient? Is there adequate room to get the proper stance to lift the patient? Like, say if there's not, regroup, redo. And then, do I need my additional providers to lift this patient? So we'll practice this some, but bring your questions.